Human Services, Ms. Renessa Williams, Permanent Secretaries and Executive Directors of the Civil Service, Deputy Permanent Secretary in the Ministry of Health and Human Services, Mrs. Tamara Howell-Robinson, Honorable Dr. Rufus Ewing, former Premier of the Turks and Caicos Islands and Chairman of Madinco Group of Companies operating as Omnicare Medical Centers, among a host of other titles. Former Ministers of Government, and we'd like to acknowledge the presence of the Honorable Karen Malcolm, and former members of the House of Assembly, medical officers, managers, and staff of the Ministry of Health and Human Services, Dr. Denise Brathwaite-Tennant, CEO, TCI Hospitals InterHealth Canada, distinguished medical practitioners and professionals from both the public and private sectors, panelists, director and members of staff of the Health Promotion and Advocacy Unit, distinguished guest, Captain Dixie Smith of the TCI Regiment, and we'd also like to particularly welcome Mrs. Sandra Garland. We don't often see Mrs. Garland out in public. As we know, she's a giant of a lady in our community, and so we'd like to welcome her to this Women's Conference. We also particularly say a very pleasant good morning to Mrs. Lisa Hall, patron of the Cancer Society, and if there are any former patrons here with us as well. Distinguished guests, members of the Media Corps, ladies and gentlemen, good morning. It's an absolute pleasure to welcome you all to this important Women's Health Conference under the empowering theme, Advocate, Educate, Celebrate Women's Health Matters. Today we come together as advocates for change, educators of vital knowledge, and celebrators of the progress we've made in the realm of women's health. Our goal is simple yet profound, to champion women's health as a top priority, recognizing that it is central to the well-being of families, communities, and societies at large. Women's health is a multifaceted issue encompassing physical, mental, and emotional well-being. Throughout today's sessions, we'll hear from an array of experts and thought leaders who will guide us in understanding the latest in women's health research, policies, and practices. Today is about lifting up the voices and experiences of women. I encourage you all to actively participate, ask questions, and share your insights as we continue today's discussions. I'm looking forward to an impactful and transformative day. I hope you are too. Let's get started. In all things we give thanks, and this morning is no exception, and I'm going to invite Mrs. Anansa Jervis to lead us in prayer.
Thank you, Sharon. Okay, I think I'm good. I'm just going to ask everyone to stand with me, please. Okay. If we can bow our heads. Heavenly Father, we gather here today, united in purpose and spirit, to celebrate, advocate, educate women's health. I lift up everyone here before you this morning. We ask for your healing touch upon those battling illnesses. Surround them with your love, comfort, and remind them that they are never alone. Grant them courage in their struggles and peace in their hearts. I also pray for wisdom and guidance for those who work tirelessly in the health sector. May their efforts be fruitful and bring hope to many. Help us to foster a community that uplifts one another. As we share knowledge, resources, and our hearts and ears are open at this conference, help us to advocate for our own health and the health of others, reminding us that self-care is vital. May we leave here today empowered to make a difference in our lives and in the lives of those around us. In your holy name we pray, amen.
Thank you very much, Anansa. I'm now going to invite the Director of the Health Promotion and Advocacy Unit, Dr. Camilla Clark, to bid you welcome. Dr. Clark.
Good morning. Allow me to adopt the protocol that has already been established. It is truly an honor to welcome everyone to today's Women's Health Symposium, where we come together under the theme of Advocate, Educate, Celebrate Women's Health Matters. Now, the World Health Organization defines health as a complete state of physical, mental, and social well-being, not merely the absence of disease. And as such, and me being the Director of Health Promotion and Advocacy Unit is thrilled that her unit had the opportunity to host this very, very important event where we will be delving, it gives us an opportunity to delve into crucial conversations surrounding a very important topic, women's health. Women are the foundations of our society, our families. They are the strength behind our communities. And they are the driving force behind our nation. Just look around the room and you can tell. So our theme today is not just about mere words. We are sending, it's a call for action. So we are here to advocate for policies that prioritize women's health and thereby empowering women to take control of their own health and well-being. We're here to educate ourselves, as well as others around us, with the resources and the support that you need to make sure that you're empowering yourself to take control of your health. And as Nelson Mandela says, education is the most powerful weapon which you can use to change the world. And most importantly, we're here to celebrate the resilience that is women. We are women, we are powerful. And we rise in the face of many, many challenges. So this event serves as an opportunity for us to engage in conversations that are at the very heart of our collective well-being. It is a chance to connect, reflect, and to dive into many issues that matter to us as women as a society, and to advocate for each other and for ourselves. So I invite everyone not just to take the event off on your list, say, oh, I was at the Women's Health Symposium. I want you to dive in, jump into conversations, into discussion. Ask those burning questions that you might want to ask based on a topic. Share your experience. And so together, let's amplify our voice and uplift all women, not just those who are in this room or joining us online, but every woman in the community and throughout the world. So thank you for joining us here today. I'm looking forward to deep, rich conversations that lie ahead, and join us, everybody, in this journey where we advocate, educate, and celebrate the importance of women's health. Thank you.
Thank you very much, Dr. Clark. The author is anonymous, but the quote says, "Healthy women create healthy societies. By caring for women's health, we care for the foundation of our world's well-being." Our first formal speaker needs no introduction, but I'll tell you this. He's a son of the soil. He hails from the island's capital. He sings melodiously. What else? He's everybody's cousin. He's one of the world's greatest kissers. He greets everybody with a kiss. And so, ladies and gentlemen, I ask you to help me welcome the Minister of Health and Human Services, the Honorable Sean David Malcolm. Honorable Malcolm.
Good morning. My, with an introduction like that, one can only blush. This morning, it's a privilege to be amongst such beautiful women in these Turks and Caicos Islands. I am so privileged to lead a team where over 80% of the management, professional management team of the Ministry of Health are women. And so you wonder why it is the best ministry in the Turks and Caicos government. But protocol has already been established. I must single out the former premier and former Minister of Health of these Turks and Caicos Islands, Dr. Rufus Ewing. And I count myself privileged to have persons like him at my disposal as advisor to this minister again. And it shows by the output that we put from the Ministry of Health. It's because we have good people advising us. And then I want to acknowledge, I know she was acknowledged already, but one of Turks and Caicos' greatest women that is amongst us today, Miss Sandra Garland. She has been advocating for women for decades in this country, even when it was not popular for women to be on the front line. Miss Sandra Garland was there, and we owe her a debt of gratitude because she has certainly advocated, she has certainly educated women in these Turks and Caicos Islands, and she ought to be celebrated. And so we welcome you here today on behalf of the ministry. And then Dr. Tannen. What do I say about our keynote speaker today? Again, I count it a privilege to have her as my friend and advocate in the Ministry of Health. You can't go wrong with friends like these and determining how we govern this country. And I want you to know publicly always that I do appreciate everything we enjoy together. Thank you for accepting the ministry's invitation today. Now, ladies and gentlemen, esteemed guests and colleagues, I say good morning again, and welcome to our second annual Women's Health Symposium. I want to sincerely thank each and every one of you for coming together for this important, very important Women's Health Symposium. Your presence here speaks volumes about your commitment and dedication to making a real difference. The theme we are gathered under, advocate, educate, celebrate, women's health matters, perfectly reflects what we all share and strive for. Women's health isn't just another priority. It's at the heart of our families, our communities, and our nation's overall well-being. Advocacy is the first step. We must continue to raise our voices and push for policies and address the unique healthcare needs of women. This means ensuring every woman, no matter her background or circumstances, has access to the care and compassion she deserves. No one should be left behind when it comes to their health. Education is equally important. When women are empowered with knowledge and resources to make informed decisions about their health, this impact is life-changing, whether it's understanding reproductive health, mental health, nutrition, or how to prevent chronic illness. Education empowers women to have control of their health and future. And of course, we are here to celebrate. Women are the backbone of our society, from caregivers to health professionals, from leaders to advocates. Their strength and resilience are the foundation upon which a healthier, more exclusive world is built. Today is about acknowledging and honoring that strength and renewing our commitment to improving the health and lives of women everywhere. As your Minister of Health and Human Services, I am deeply committed to those values. Every day, we are working to ensure that women's health is not just talked about, but truly prioritized and protected. By coming together as health professionals, advocates, and all of you here, we can make a lasting impact. Thank you for your dedication and for the incredible work you do, and for being a vital part of this conversation. Let us take what we gained today at this symposium and turn it into action, because women's health matters now more than ever. Thank you, and may God forever bless you and these Turks and Caicos Islands. Have a good day.
Thank you very much, Honorable Minister. Let me just put it out there. The professional consultation and advice that the Minister spoke about from our former Premier and Minister of Health comes at no cost to the current Minister. Absolutely. Yes.
Thank you. No charge.
No. And so thank you very much, Minister, for being here and for sharing with us this morning. I'm now going to invite the Acting Permanent Secretary in the Ministry of Health and Human Services, Ms. Renessa Williams, to bring us her remarks. Acting PS.
Esteemed guests, colleagues, and fellow women across the room, good morning. Adapting to protocol that have already been established, it is my great pleasure and privilege to welcome you to the second annual Women's Health Symposium held today. This year's theme, Advocate, Educate, Celebrate Women's Health Matters, speaks directly to the heart of what we aim to achieve, empowering women to take charge of their health and well-being, and recognizing the vital role we as women play in shaping our families, communities, and societies at large. As women, we are the nurturers of life, shaping the future through our youth and inspiring the next generation of young women. It is through our strength, resilience, and dedication that we not only uplift those around us, but also help to guide the next generation toward a healthier and more prosperous future. This is why we as women must stand together to advocate for one another, ensuring our voices are heard and our needs are met. We must educate ourselves and each other on the importance of leading healthy lifestyles, balanced lives. And most importantly, we must celebrate one another, acknowledging the tremendous contributions women make in every facet of society. At the Ministry of Health, we remain committed to continuing our programs and initiatives that do just that, to advocate, educate, and celebrate all women. We are here to empower, to inform, and to inspire. Let us also remember the words of the trailblazing Maya Angelou, who said, "I am a woman, phenomenal woman, that's me." Together, we can assure that all women, phenomenal in their own right, are supported, uplifted, and celebrated. Thank you for joining us today, and I look forward to the powerful discussions that will follow.
Thank you very much, Acting PS. We also wish to acknowledge the presence of Dr. Dawn Perry-Ewan, Chief of Medical Services, TCI Hospitals, InterHealth Canada. Dr. Perry, thank you for joining us. Always a pleasure to have you. Dr. Denise Brathwaite-Tennant is the Chief Executive of the Turks and Caicos Islands Hospital, InterHealth Canada, and has over 20 years of experience operating at various levels in healthcare. She has been privileged to be at the forefront of initiatives that have driven hospital and health system developments, continuous quality improvement, people-centered services, and health innovation. Dr. Brathwaite Tennant was appointed lead consultant of the emergency department of the Turks and Caicos Islands Hospital InterHealth Canada in April 2010, which was a first for the islands as a Belonger consultant specialist physician in emergency medicine. Through a series of promotions, she progressed up the ranks, holding several leadership positions as head of the emergency department, site administrator for the Coburn Town Medical Center, chief of medical services, with her current position as chief executive officer. Throughout her career, she's led the introduction of new health services, programs, and policies, and possesses a wide range of experience in healthcare accreditation, quality, and health education. She is the faculty and founding member of the American Heart Association Lifesaver Training Center, delivering the full suite of resuscitative courses. Dr. Brathwaite Tennant holds a Master of International Management with a specialization in health sector management degree from the University of Liverpool in the United Kingdom, forensic medical examiner for sexual assault and rape, and a certified professional in healthcare quality. Her desire is for empowered people to live to their full potential in healthy families and communities because they're making healthy choices. Dr. Brathwaite Tennant is a wife and mother of 3. Now, usually, when we see the red shoes, we know what to expect. Today, she's wearing a bright pink, so we're expecting just as much a powerful message. Ladies and gentlemen, please help me welcome our guest speaker, Dr. Denise Brathwaite Tennant.
Thank you very much, Cheryl. The powerful pink means that I'm a powerful breast cancer survivor. And good morning, everyone. And please also allow me to adopt the established protocol. And I do love the theme for this, and I thank you very much for inviting me to speak. And I hope that we learn a lot today together, and we not only just learn it, but we use it to be agents of change in our homes, in our churches, if that's what you do, in our communities, in our workplaces, and in our nation. Because the Turks and Caicos Islands, I have heard it said before, we're pretty much unique in that we have a lot of ladies who are in leadership within these islands. So we have moved up the ranks. But I think what we need to ensure in our migration up the ranks, that we don't leave anyone behind. Okay? And today, that anyone for me includes not only just our boys and girls, but we have to think about the generation of males that we're losing to the streets on a regular basis. That is our future that's dying in the streets. And so we also have to find a way, as we advocate for each other as women, we have to advocate for what's happening in homes, in the rearing of our young people, our new mothers, our fathers, and all of that, so that we can protect and save our future generation, because that's also a part of our public health advocacy role as well. So with that being said, we are here to advocate, educate, celebrate, because women health matters. So remembering to turn this on. There we go. What I'm going to speak about today, and I'm going to enlist your feedback as well, really centers around these 3 areas. Empowering women so that women can advocate for their health and the health of others. Educating women on the important health matters that are unique to them and the importance of that, and you'll see a lot of that on the agenda today, and celebrating our resilience. We have come a long way, but we are more impactful when others, and we share our success stories and what we have developed and learned to be resilient. So starting with empowering women to advocate for their health. If you have your cell phone and it's on the internet, what one word comes to mind when you hear the word advocate? And if you cannot scan the QR code and enter your one word, you can go to slido.com and put in that number, and you will be able to enter your one word. So we're creating a word cloud for us here today on what we think that word advocate, what does it mean to each of us here within the room? Represent. To teach. Educate. Make everyone aware. Support, encourage. When you see represent staying bold, that means many persons have said represent. So it's a common word. Empower. Defend. I like that word. Speak up. Okay, great. It seems like most of us have answered. And very common, those words all really define advocacy. Because when we're advocating for others, it's important. There I go with this, learning this clicker. Losing my word cloud. Oh, that was a tremendous click. Am I going backward or forward? There's my cloud. Okay. So let me make sure I'm clicking the right thing. No, I'm not. Okay, so I won't use that button. So, it's important. And all of those things I think are very important and reflect advocacy. We must teach, empower people so that they can make those informed choices for themselves and be a role model. We'll get into that in terms of sharing our stories, networking, mentorship and peer support, and giving people a voice who you're either empowering them to have a voice to speak up for themselves, or you're speaking up for them. And I like that word too, strength. Give them the strength to be able to feel and the confidence that they can speak up for themselves as also advocate for others. So very nice. So advocacy, in several of the definitions that you will see, speaks to essentially ensuring that everyone has the opportunity. There's almost a leveled playing field for persons to be able to get access to what they need in order to have optimal health and receive the care that they need. And so it involves not just speaking, not just wanting that optimal health for everyone and that empowerment for everyone, but it also, as was mentioned today, a call to action from each and every one. And our efforts and our actions must be so galvanized that it's around promoting and protecting the health and well-being of people. And health and well-being, as I mentioned earlier when I speak about some of the things that we're seeing with our young people today, isn't just only your diabetes and blood pressure control. Health also has to do with the whole individual, as was mentioned. Our mind, body, and soul, our spiritual, financial, everything about an individual is important and impacts or impinges on their health. So that is a focus that we have to keep in mind also when we talk about health and well-being. And when it comes to advocacy, there are several different types of advocacy depending on what are our area of focus. When it comes to patient advocacy, it's really helping patients. Many of us who work in the healthcare system, we know where everything is. We're used to it, we're seeing it. But we also have to be cognizant that sometimes there are people who are navigating through our healthcare system and they don't fully understand who does what, who's responsible for what, When something happens with this particular health matter, which of our entities is the best place to go? And so patient navigation and supporting people navigating through our healthcare system is an important thing. Also, we as practitioners, whether we are health practitioners working in hospital or primary health, or even we are part of policymakers, health advocacy, any agent, we also have to remember that we speak a language. So lawyers speak a language, judges speak a language, we speak a language. And so it's very important that also in that advocacy role that we make sure we adapt and change that language, that people understand what we are saying. So communication is very important part of patient advocacy. So a system to be able to communicate as well as to navigate and informing them of their rights. What are they, what do they have? What are they entitled to in each aspect of whether it's the healthcare system or any institution within the Turks and Caicos Islands, really. Though it's a health symposium, but any institution, they need to know what are their rights, what are their choices, and to be informed. Gone are the days, I think, where we should promote the spoon feeding. We should be in a position where we are speaking to people, we're giving them choices, and we're empowering them and informing them so they can make informed decisions about their health. Because what we find is that you can write things down on a piece of paper. You can do do's and don'ts and say and give instruction. When persons are empowered to take responsibility for their health and for themselves, you actually get a person who makes better decisions about their own health personally because they have a personal stake in their health. They adhere to what you tell them a bit more, and they do their research. And they come back with you with questions so that they can tailor what you are saying to them, to themselves, and you yourself, as the individual managing and caring for them, can hear things that is unique to them that need to be addressed, that's unique to them as an individual. So public health advocacy. This is very important for, again, us who are the policymakers in terms of the different policies, legislations, things that we create for society, for people, for women, that actually are empowering of women and help women in order to have equity within the healthcare system, equity within community. So public health advocacy is also very important when we are making legislations to ensure that this legislation, this policy, that it actually helps and empower women and families, and it doesn't create any barrier. So anything that we produce should be able to create a greater access, greater understanding, social protection, right? And so public health advocacy is also very important. Some of the things that I have heard are the daycare policy around supporting persons with daycare. And I think that goes a great and a long way. Because many of us, though my kids and I'm an empty nester now, I remembered what it was like with my 3 children, you know? I mean, they determined when I moved to Provo, where I live, proximity to the school and work. And of course, you would hear, you know, if we're all honest, because I had to do it too, or if I didn't use someone to assist me in picking up my kids, either my husband, because we both work, you know, I have to step away, I have my school run, right? So, you know, and I was fortunate to have someone who could stay home with my kids after I picked them up from school. But there are others who don't have as fortunate with those finances to have that. So creating supportive environments for women to not only achieve their best potential and contribute to society, but also take care of their roles as mothers as well. So they shouldn't have to sacrifice what we're doing for our children because of the job also. So those are also empowering environments. The school lunch program, to ensure that there's healthy meals being promoted, and it's not just happening by osmosis, meaning you don't leave schools to the side and promote, we're gonna accept chips and high fructose type juices, but also to promote healthy at a young age within the schools with the food and nutrition policy. So those are just some examples that are public health advocacy. And of course, those solutions have to be evidence-based when we come up with them. Now, health system advocacy, and that really speaks to many of the things that I spoke about earlier, which is to ensure that we're removing any of the barriers that to care. For example, one of the policies that the National Health Insurance Board has, once you are a pregnant mother, you are co-pay waived. Now, why is that? That's to ensure that the mother does not have any barrier to access for care. The strategy within TCI around universal health care coverage, why is that? That's to ensure as best as possible we remove any barriers to any individual accessing at least the primary health care that they need to have around promoting preventative medicine as well as access to care. So that's also very, very important. Socioeconomic status, race, and gender, that should never be a consideration, but we do know that there are disparities that are associated with that. Disparities associated with access if you have a low socioeconomic status, disparity if you may be a certain race or a gender, and disparity if you may be of a certain nationality or other types of status. We know that, right? But our goal, as remember I said, leaving no one behind. Our goal is to reduce those barriers because we recognize that healthy individuals create healthy societies. And we end up feeling the reaps of that if persons don't have access to the resources and the care that they require, right? We see the downside of that, right? So they come in sicker, or there are other social impacts that takes place in our society that we still have to throw the resources at to try and fix and manage that. So it's very important also that we address disparities in our policy and our approach and our empowerment and the voice that we are given towards advocacy. So why empower women? Well, some may say I'm biased because I am a woman, but I draw on my observations. When I go to church, it's largely women. When I go to work, it's largely women. Okay? Of course, this is a women's empowerment, so I'm expecting to see largely women within the room. But we know, let's take, for example, education. The University of West Indies previously put out as statistics. 80% of their graduates in Rising are women. So we don't know, we're having a little bit of a shift as it pertains to that particular statistics because we don't also want to leave the men and the boys behind. But it's quite important to empower women and girls. We're in the home, we're in the workplaces, we're in the schools, we are the main child raiser, not being biased. We men raise children too, we're supposed to raise them together, but we know the reality of the day. We are nurturers. We're there shaping those young minds in front of us. And so it is very important when we empower women, we have a great impact on society. When women are less empowered, they're left behind, I do believe we see the impacts of society in many ways, not just health. So it's important. There's a crucial role, evidence-based role, between empowering women and health outcomes. With that being said, how can we as women advocate for our own health? I'd like to hear your opinion on that. How can we as women advocate for our own health? What active role can we play in advocating for our own health as women? Yes. I frequently tell Yolande Robinson I love the name of her school. It's called Learn to Lead. And I asked her why it's called Learn to Lead. She said, you first need to learn in order to know how to lead effectively. So I like that. We must lead by example, research and education. We can take down policies from North America or wherever else. We're going to take down policies or documents or any form of operating procedure or any form of document that we're going to try to adapt to the Turks and Caicos Islands. But what is even better if we have our own research about our own population, our knowledge, attitudes, and practices? What are some of our vulnerabilities? What are some of our system gaps? If we have some research about that, for example, we have breast cancer as the #1 leading cause on our hospital registry, and prostate as the #1 leading cause within our hospital registry. And some of the things that we're looking at is monitoring to see how much our women who meet the criteria for a BRCA genetic test are actually BRCA positive. And so we're looking at that data because what is it saying about our particular population? For example, in the Bahamas, where they did a BRCA study for several years, and they found that they actually had several women who were BRCA positive, and also they have a similar picture to us in terms of their women had first diagnosis of breast cancer around the age of 40, and the disease tends to be a little bit more aggressive. So we do need to continue to gather data about what we're seeing about the population here in the TCI and make those treatment policy decisions in regards to that. We need to know our body. Yes. Ask for what we need. Speak up. Be open to learning. Help. Speak up and seek when necessary. All very good points. That's how we advocate. So, educating women on important health matters, and this is why it's so important, this symposium here today, because it's us in the room, but it's also being shared on Zoom for others to hear. And there are going to be a lot of presenters here that are going to give important information that are important for health information for women. And so these types of forums, along with other types of forums, are very important in empowering people by educating them about matters that are important to them. So that brings me to literacy. Literacy. We know the more literate an individual is, the more likely they are to move themselves out of poverty or stay out of poverty. It's not 100% the more likely. Well, let's triangulate that to health. The more literate an individual is about health issues, their body, understanding health topics, and applying that to themselves as individuals, and also being able to advocate for individuals, they make better decisions for themselves and for their family, which translate into a more healthy family, community. So it's crucial. It's crucial, and it's something that we need to continue to advocate for, and it's something that we need to continue to ensure that when we're doing so as well, be mindful of our diverse population. And so when we're creating opportunities for literacy, that we meet persons also tailored to their language as well, and meet to understand how their health-seeking behavior has any religious, cultural, or other types of connotations and context to them that you have to educate to say how this either helps them from a health-seeking or health behavior perspective, or how it actually can be harmful to them. So it's very important, and the higher the health literacy, the better the outcomes and reduce disparity. So it's very important. Personal health literacy is very important also. I mentioned the empowered individual who understands their body makes better decisions. So they're well informed, They're happy to talk to the medical staff about what's happening, and they're able to make the right decisions. Organizational health literacy is also important. And that speaks to the fact that we have to ensure that whatever material content we're putting out, whatever we're designing, it has to be something that is seamless, understood by our general population, and something that is relatable to them. Now, I've noticed that gone are the days where you're going to give people 2 and 3 pages of anything. You have to create a video. And you have to create a relatable video. And we can see that when we put out content. You put out the written content, you may get 3 to 4 likes. You put out a nice pictorial with your message, or you put out a video, you're going to shoot up to somewhere 200, 300, it's going to drive. This is going to download. They're going to share it. So we have to tailor, as organizations, as institutions, our health or whatever literacy program you have, we have to tailor to what we know people are going to read, what they're going to look at, and what they're going to, in a language that they're going to share it in. It's very important. Health information must be accessible, and the services must be easy to navigate. So again, I ask you this. People living within the TCI have a high level of health literacy. What do you think? People living within the Turks and Caicos Islands have a high level of health literacy. Right off the bat, disagree. I got 10 people. What? 10 person, and we getting 100% disagree. When we get in the QA, I'd like to understand what's driving that. Okay? But disagree. So I put this question out there because many of us in this room are in some sort of position of influence. And so if we think that there is a gap around health literacy, and I have told you that health outcomes are also influenced not only by being empowered individuals, but knowledgeable individuals, a literate society, then this seems to suggest we have work to do. But then we have to ask ourselves, what's the gap? Because Dr. Ewing, we can tell you, the 2 Dr. Ewings, I can tell you, many of us, I think Larissa can tell you, many of us around here who are health professionals, we probably more than our hands and toes and feet can tell you how many times we have spoken, churches, forums like this, conferences, all of these things. So if our temperature is telling us that the health literacy is not at the ideal level yet here in TCI, where they say we need to rewind and reload and think about how we are delivering that. Because I am looking at all of us in here who are in that position of influence and power. So, we have to do that research to understand what are the gaps, why are we not getting through and seeing what we want to see around health literacy within the TCI. Education and awareness, workshops, seminars, these are all the things that we have done. But what is showing, we need to see what are the knowledge, attitudes, and practices in these islands around health and tailor our programs towards addressing that, because we want a literate TCI. Peer groups and mentorship programs. I think this is something that we need to explore more. Why say that? I have a sphere of influence. Each of you in here probably have a sphere of influence. We have community members and different communities who are potential influencers. We have to see how we can mentor different people to be the vision casters in these different communities around health and health literacy. So as we seek to sharpen each other in our own peer groups and strengthen our own roles and responsibilities around literacy and education and awareness, we need to find new ways and strategies to get different influences. You know, like some of these young people have a large following on TikTok and Instagram and all of these things. They are influencing. You know that, right? They are influencing heavily. How can we harness that to influence health literacy to this generation? Okay. Access to resources, and this really has to do with our whole policy around universal health coverage. And so we need to continue advocating and doing this. But remember that Turks and Caicos is a melting pot. Now, we're quite diverse. And to ensure whatever it is that we are producing, it is hitting and meeting those needs of the diverse. Next time you come to the hospital, you will see this Ask Me 3. I want to tell you what that means. This Ask Me 3 is posted there for people to keep in mind. Remember, before you go into the doctor, or before you come to see the doctor, write down 3 things you would want to ask the doctor. Because, you know, this is what you call white coat nervousing, even though they don't wear white coat that much in the hospital nowadays or anywhere else. But, you know, you sit down to the chair in front of Dr. Blythe and maybe all the words fly out of your head because you're so nervous. Even though you saw him before, you don't know what he can say about the blood test and all of that, okay? So you write it down. What is my main problem today that needs to be addressed with me? And what do I need to do? Look, when you say what the doctor need to tell me to do per se, it's what do I need to do to address this issue? And why is it important for me to do this? Why is it important for me to take my blood pressure medication? But sometimes when I check on the machine, the blood pressure is normal. So when the blood pressure is normal, I don't take it. So why is it important for me to take my blood pressure medication regularly? Why should I not miss a dose? What is this missing doses? What does that mean for me, the patient? So Ask Me 3, communicating well, and the patient and the doctor are in a relationship revolving around the patient's health, and the patient must walk away empowered to do what they need to do for their health. Because if they don't walk away empowered, they may buy that medication, copay waive sometimes from NHIP, and that may sit there and take now and then they come back and see you, write another prescription to go back, and if you were to go in their home and check their medication bag or thing, you see a whole pharmacy full of medication pills, right? So, addressing that gap. Policy and engagement. Policy, advocacy, training. So there's something that we looked at as well, and we're having a focus on. We have about 4 persons who did the University of Miami patient advocacy training. I would recommend it for all of us as healthcare professionals or persons dealing with health, that advocacy. But it certainly opens your eyes from the perspective of the patient and what brings value for them. Promoting self-care. Now, this is where I must speak to all of us. So we arrive now. We breaking down some glass ceilings, boy. Okay, we stepping into the boardrooms. That's us. We's the policy makers, right? We's ministers now. We governor and we deputy governor, right? We even been premier. Okay, so if we want to stay in the home and run the home, we can. If we want to come out of the home and move up the highest level, we can today. But ladies, let's not forget ourselves. Let's not work ourselves to death. Let's remember ourselves to strike a balance. I preach into ourselves, all of us, okay? Let us remember to strike a balance. Our mental health, our self-care is very important, okay? Prior to getting my breast cancer, right? I never really thought about self-care like that because I just think about service. I want to serve. I don't know how to say no. right? I want to serve, serve, serve. I get such pleasure out of serving. And then a disease slows you down. And you say, what? You have to take care of yourself. You can't serve everybody. There was only one man that was named Jesus, and you're certainly a naming Jesus, right? Okay? And it's okay to say no. It's okay to say, listen, I stretched out, I can't do that, right? It's okay to take breaks, you know? So I don't know if I'm speaking to any type A personalities out there who feel guilty to take breaks. It's okay to take breaks. Because when we go on, they'll find somebody just like that. They will boo-hoo at our funerals. They'll give us a bunch of flowers, and they'll speak highly of us. But somebody going to have the job after that. So just remember, let's take care of ourselves, and remember, self-care, okay? Let's create our resilience. Why? Because a resilient woman, I believe, and again I may be biased, is such an inspiration to other women and other people. So let's inspire and remember to take others with us. Support, that peer support. Celebrate, we need to share our stories. Now, some people not so brave to share the stories. And you tell the truth, I shared my story, very limited in the early days because I had young children, and I knew that there's still a stigma around cancer here. Why? I don't know. And I didn't want the children to tease them in school. And you know, black women, maybe wear wigs anyway. And you could just tattoo your eyebrows, you know? But, you know, our children are old and they could see that I am doing well. I started to share my story. Now, some of us may not be brave to do that, but I share my story because I want to empower people. Early detection, you must do it. Know your body, know your risk, know your health. Don't be afraid to go and get the mammogram and find out what the result is. And so sharing our stories of overcoming how we did it inspires someone else. So share our stories and support each other, build those networks, celebrate our resilience, events such as this, and also share our achievements. Don't keep it to ourselves. Share our achievements. You never know who you may inspire. And so advocate for change. We are where we are because someone was advocating for change. So let us continue to advocate for change. Take care of ourselves. This is not who we want to look like at the end of the day. This ain't what we want. She looked like she in control right there, but we know things fall apart. If things around her ain't fall apart, she's going to fall apart. We are not superheroes, okay? Well, we're superheroes in some ways, but this is not the superhero we want to be. It's not sustainable for us ladies. And so, have those initiatives, and so I like this young girl here who is sewing. You know, my nephew, he was with me recently, and we were driving around Providence, and he said, Auntie, I have to stop by the sports center, and I have to get a tam. So I said, well, can we get a tam by the sports center? And up comes this lovely young lady and gave him 2 crochet tams. And he put in her hand $50, $25 a tam. And I looked at that and I smiled to myself. That young lady is resilient. We have to empower them to be like that. She's making her own money. She looked like she's 14, his age. And he said, yeah, she advertises it on social media. It's 25 she crochet, and she learned how to crochet. And she had shared her story, and you know, people are resonating, young people are resonating with her story, and they're supporting her. We have to empower that and keep that going, because education is, what's my take-home points? Advocate for others as we advocate for ourselves. We can't be just alone, us alone. As we move up, let us advocate for others. Empower. Don't do it for me. Show me how to do it. I like that statement. Empower me. And then support me. push me, motivate me. This is where we want, this is what we want. Promote healthy living and self-care. Celebrate our success publicly. Put ourselves out there and encourage and inspire. And I leave with that, empowered women, which is who we are, empower women. And when we empower each other, we empower our homes, we empower our community, we empower the nation, and we change the world. Thank you.
Don't go away, Dr. Brathwaite. Any questions? We'll take 5 minutes questions. Anybody with a question? Hey, free medical advice right now. Any questions, anyone? I guess we have a lot of medical practitioners in the room with their own answers. No questions? Going once, going twice, gone. Thank you very much. So our guest speaker left us with the message of empower, educate, and celebrate, and the fact that we should be agents of change. She also mentioned language, and I smile, because those of us in communications and broadcasting, we're taught to always use the simplest form of language because we have no idea of our audiences. And persons should need their dictionaries to understand what we're saying. So that idea of language, Dr. Brathwaite-Tennant, resonated with me. Dr. Brathwaite-Tennant, whenever you speak, we just don't become more health literate. We also always gain a wider perspective of life and the type of individuals we should strive to be. And so we say a very big thank you for this morning.